Hi everybody, Mahmoud Taif is my name. Today my presentation is about pulmonary emphysema in cattle. In this presentation, I will present the disease definition. Then I will go to revision consists of respiratory system. And after that, I will compare between normal lung and lung have emphysema. Then I will talk about cause of emphysema. Last but not least, I will talk about disease symptoms. Emphysema is part of a group of diseases that make up COPD or chronic obstructive pulmonary disorder. Now, COPD is a name given to disease in which air exchange is weakened by the narrowing of the lower airways or by the destruction of the alveoli. Now, let's focus on emphysema. Emphysema is an chronic airway disease of the lung. Emphysema characterized by the destruction of the alveoli wall, and elasticity. To understand this disease, we must first review the respiratory system to get better understanding what this disease is all about. The respiratory system consists of anatomical structure, involves ventilation and gas exchange. It allows us to breathe oxygen in and exhale carbon dioxide out. Respiratory tract can be divided in two parts, upper and lower respiratory tract. Upper respiratory tract includes mouth, nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles. Bronchioles contain as a terminal bronchioles, respiratory bronchioles, alveolar duct, and starting with the lower respiratory tract, which is alveolar sac and alveoli, where gas exchange takes place. Let's zoom into normal lung and normal alveoli. So, the alveoli are found in bundles. Here we have bronchioles and terminal bronchioles, which will join to alveoli, and alveoli is composed of many alveolus. There is rich blood supply around the alveoli because this is where gas exchange takes place between oxygen and carbon dioxide. So we have deoxygenated blood entering the alveoli and reoxygenated blood leaving the alveoli. Another fundamental point to take in about the alveoli is that the terminal bronchiole and each alveolus is wrapped around by elastic fiber. But why would they wrap around by the elastic fiber? Well, this is to allow the alveolus to expand when receiving oxygen and to deflate when exhaling carbon dioxide out. So remember, oxygen and carbon dioxide are exchanged essentially within the alveoli. So gas exchange occurs between each alveolus and the blood in the capillary. Also, if we cut a cross section of the terminal bronchiole of this normal lung, we can see it does contain a wall. It has some mucus and an open airway, which is very important because this will allow gas to flow comfortably. Now, let's focus at the lung with emphysema. Emphysema is loss of elasticity, both terminal bronchiole and alveoli. Also, emphysema is permanent enlargement of air space with destruction of alveoli and alveoli wall, and usually this is without a voice fibrosis. So the main reason for destruction of alveoli and elastic fiber is the immune cell begins creating chemicals known as protease, and this is all part of inflammatory reason. And increase of protease result the destruction of elastic fiber and collagen. And this will cause enlargement of airspace and destruction of the alveoli and the walls. Essentially, protease will cause destruction of the alveoli and elastic fibers. It's important to understand the alveoli itself does not enlarge. It is the space that enlarges. So, let's look about cross-section of the bronchiole with emphysema. We see thicker wall and increase in mucus due to inflammation caused to narrowing of the airways. The narrowing of airways will cause difficulty in breathing. Now, we talk about the most common cause of emphysema. The most common cause of emphysema is due to factors such as air pollution and genetics. In the developing world, common sources of air pollution are wood composition. Exposure to these irritants cause an inflammatory response in the lung, resulting in narrowing of the small airways and breakdown the lung tissue. The infected cattle will appear many symptoms as following: difficulty in breathing, coughing, cattle do not normally run a fever, anxiety, separation from a group, collapse, death. There is no specific treatment for emphysema. Case may recover without treatment. Most severely affected cattle will not respond to any treatment and will die within a day or two. At the end of my presentation, I would like to thank you for your attention. I hope I will be helpful and useful. Thank you and goodbye.